Okay, hello TMB Wellness. Before I start, let me introduce myself. I am Doc Mario. I am also a medical doctor. Actually, I'm a neurosurgeon by profession, and therefore I treat brain tumors, strokes, spinal cord tumors, brain injuries after an accident. So that's basically who I am. And I've been doing it for the past 23 years already. What I would like to talk about today is because of this concept. Okay, so this is the concept of illness or wellness. Okay, so if you look into that slide, you will see that there's a picture of an operating room. That's the picture with the light, and it says illness. And it's a fairly small box as compared to the lady in a yoga pose with a large name, which is wellness. So, in reality, there are more people who are well than ill. Unfortunately, they don't know if they are either well or ill. If you're ill, you know that because you're already in dialysis, so you're ill. You've had a stroke, you're ill. You have a non-healing wound in your leg, or you have a dark colored leg because of poor circulation, and that's considered illness because that's part of a diabetic foot. You've had a heart attack, meaning you have a stent, or you have a pacemaker. You have cancer, end stage renal disease. You have cirrhosis of the liver. You have Alzheimer's. These are all illnesses, and that's unfortunate that you reach that part of the stage of this wellness illness slide. But there are also people who know that they are well. These are the people who have regular blood tests. Blood pressure is fairly normal. They feel good. For their age, they're able to do activities that even younger individuals cannot do. They have a program. They eat correctly, so they know they are well. But that's only a few. If you notice, the picture is stuck together, illness and wellness, because it's actually in a spectrum. You can be on one side, you can be on the other side, and you can just follow that certain line. And that connection between the two pictures denote a small door. And that small door is actually what we call the metabolic syndrome. And the reason why we have to know that is because you can have the metabolic syndrome without feeling anything, and therefore a part of your body or a part of who you are is already in the illness side. If you know that you have the metabolic syndrome, then maybe we can pull you out of the illness side and we can pull you back to wellness. And that's the secret of why we are here, or that's the reason for why we are here. And the secret is knowing if you are in a well or metabolic syndrome, so that we can pull you back to wellness. So why do we have to find out if you are in that small door, whether you're part of your body or your whole body or the whole of you is already crossing over into the illness side? That's because 80%, it's a statistically confirmed number, that 80% of people nowadays die because of complications of the metabolic syndrome. And we call that non-communicable disease. Okay, so 80% of them die. Out of those 80%, I would say more than half would have been preventable. Okay, so it's a big number. Heart disease, stroke, diabetes of course, cancer, are the top four, top five causes of death in the world today. And you can definitely prevent a heart attack or a stroke or diabetes.